I'm Sarah. My number is one of the lowest numbers on that piece of paper that came around the room, so please be very gentle with me. I'm a doctor by trade. I'm a geriatrician, so I work with the older adult population. And I started observing the Ambridge cohort about 3 years ago. And I noticed there were a few differences. So, at age 65 in the UK, women have a life expectancy of about 85 years, and men about 83 and a bit. And men can expect another 10 years, so up to about 75 of it in good health. After that time, you start getting various illnesses taking their toll, and you start slowing down a bit. Women, you get a little bit longer, 11 and a half years. And there's a big gap between this healthy life expectancy in the most deprived areas and the most affluent areas. Now, Borsetshire seems to be a bit of a data hole. I couldn't find exact figures for healthy life expectancy in Borsetshire, but I suspect it's towards the the upper end of this sort of limit. Either way, we'd expect our 75-year-old, 80-year-old, 90-year-old population to be doing a bit less. Then I looked at Ambridge. At age 65 in Ambridge, you're still running the farm, you're sorting out fights between the children. At age 70, you're still running the farm and sorting out fights between the children. But you're also heavily influencing the village fete. You're producing Amdram extravaganzas, and you're enjoying a sex life that most people would be too tired for in their 30s. I'm 35, I know. At 80 plus in Ambridge, you are single-handedly cooking for a family of 6. You're regularly babysitting an infant. You're volunteering at the local tourist trap. You're indulging in flower and produce skullduggery of limits to which have not been seen before. You're running the Lent appeal. You're falling in love all over again. And you're still sorting out fights between the children and practically running the farm. So, what is it about the current older adult population in Ambridge? They are ageing so very, very well, and it just didn't make sense to me. So I started looking at the evidence. So this chart basically shows what happens as you get older. The darker blue, the more medical conditions you've got, okay? The lighter blue, the fewer that you've got. And you can see as you get towards the end of the chart towards me, you're getting to 85, 90 years old, there are fewer and fewer people that haven't got any medical problems. If we look at the Ambridge 80 to 85 population, they're all in this top corner up here, okay? We know that Joe's got his farmer's lung. More about that later. I think there's been a few heart attacks. Someone takes a prescription, someone walks with a stick, but on the whole, nobody's got chronic lung disease, nobody's got chronic heart disease. I don't think anyone's got diabetes, despite all the lemon drizzle, but we had a paper on that. It's just really rare to have anything wrong with you in Ambridge. Now, in medicine, we say it's not about what you've got wrong with you, it's about how it affects your life. So this brings me on to another concept in medicine, which is frailty. So frailty is a gradual process of little bits going wrong. You start off like this shiny new car. Paintwork's nice, no stone chips, no scuffs, no grazes, it smells really good. As you get a little bit older, you might have to have some bulbs changed, you might get the tyres done. Maybe there's a chip in the windscreen, so you get that replaced. We take bits out, we put them back in. But eventually the bodywork gets holes in it. Then the exhaust pipe falls off on the M4. And eventually your nice shiny new car has turned into something a little bit like this. This is what happens essentially to the human body as you get older. It might not be major things, it's just this gradual accumulation of deficits that means that your car does not run as smoothly and it doesn't work anymore. So in human terms, you've taken a path from the cradle towards the grave, not quite to it. But what we also recognise in medicine is that as you get older, we don't know what's going to happen to you. You can be at this end where you're fit, healthy. This man runs marathons at 104, at least he did. I don't know if he's still going. To the other end of the scale where you are bedbound and requiring an awful lot of help and not able to do much for yourself. Now, you can be at the managing well and very healthy end of the scale in your 50s in some cases, and in some cases in your 60s you could be at the other end where you have a lot of medical troubles, a lot of conditions, and you can't do a lot. We like to put numbers on it as doctors, not for our own benefit in geriatrics, but mainly because we have to explain to surgeons that some people may not be fit for this operation that you want to do for them. So we have developed something called a Frailty scale. Now, if you say someone has a Frailty score of 1, 2, or 3, they are managing well. At the one end, they are better than most people of their age. These are the people that will be running marathons, climbing hills, doing amazing things. As you get into the 2s and 3s, they're still living independently, doing a lot for themselves, but perhaps not as much as the others. By the time you get to a 4, we say that you're vulnerable. And this is perhaps where you're needing help with things like doing shopping, managing finances, just odd little bits of daily living. Down this end of the scale, you're into what we call frail, and that's where you're needing help with daily living, you're needing help with things like preparing meals. Further you get down, help with washing and dressing, then moving into help with toileting, and eventually till you need help with absolutely everything. Okay? If we look at the general population, as you get older, we expect you to get more frail. Now, in the 60 to 69 age group, there are people that are considered frail. It's higher in deprived areas, like I said, and these are people who have long-term medical conditions that they're living with that are taking a toll on their well-being. As you get up to 90, you're expecting about 60% of people in the population to be frail. Okay? Bear this in mind with Ambridge. If we look at the Ambridge cohort, there is nobody under the age of 80 who is anything other than a 1. Our 70-year-olds are people like Jenny and Brian and Tony and Pat, who are still grasping life by the horns of their brand new shiny Montbéliards. Do they have horns? I should have checked that. They're starting new businesses. They're doing everything. They are living life to the full. If we start looking at the over 80s, and I had to take a bit of a liberty here because I couldn't find out the age of one of them. So probably our fittest are Bert and Jim. Now, I don't know how old Jim is. I Googled. Someone will probably be able to tell me in this room his exact birthday. Jim Lloyd, anyone? I see Jim as a similar age to Bert. But Bert and Jim are still both very active members of the community. They're volunteering, they're running things, they're out and about, they're doing stuff. They are definitely a 1. If we move slightly up the scale, we've got Jill, still doing a lot for her family, perhaps less than she was. I don't think she's driving anymore, but she is fantastically active for the age of 88. Coming along slightly further, we've got Peggy, 94. Peggy is living independently. She doesn't do her own shopping anymore because Kate's moaning about it. But she's still pretty good, you know. She's not needing help with an awful lot. I definitely wouldn't put her into the vulnerable category. Probably the person I am a little bit worried about is Auntie Chris. Now, when I pitched this paper, Auntie Chris had not yet had her fall, and we will come on to Auntie Chris a bit more later. But she's recently moved into what I understand is a sheltered accommodation environment, so she's got people around her all the time. She's not necessarily getting help, but I don't think it would take too much to push her into receiving help. And I think I've forgotten someone. Joe Grundy, 97. Now, Joe's an interesting one. I actually put Joe as better than Auntie Chris, because even though Clary might cut his toenails and he's got his farmer's lung and whatnot, Joe doesn't do anything that he doesn't want to do. And I don't see Joe Grundy as a man that would want to cut his own toenails. If he has someone in the house who would do it for him. Likewise, having his own private bathroom wasn't a necessity, it was something that Joe quite liked to do. Joe goes through life doing what he wants. I think Joe is capable of far more, and I actually argue with whoever it was that said that Joe's on the way out. Because I think there's someone in Ambridge who is actually frailer than Joe and Auntie Chris, and that's Bartleby. I've put Bartleby slightly further up the scale than Auntie Chris because I don't think it would take much to push Bartleby into frail. He may already be there, and I wonder, maybe later we'll talk about the entwined characteristics of Joe and Bartleby. Anyway, so why is this happening? Is it the Ambridge Affluence? Now, this chart shows the number of patients with lots of medical conditions, which is called multimorbidity, in comparison to their age and socioeconomic status. The red line at the top is the most poor, and the black line at the bottom is the least poor. So for the kind of Brians and Jennifers and Pats and Tonys, then affluence, yes, it may be making a difference in how well they are and what they can do. But by the time you get up to the older age group, the 80s plus, you can see the lines have all come together. It doesn't really make much of a difference. What the Ambridge Affluence is probably doing is stopping you dying of your heart attack and your diabetes at a younger age. It's not really affecting the very older bunch. So I started thinking about other reasons. Looking at Lillian, we wonder if there's some sort of preservative. Now, recent studies have suggested that drinking any alcohol is in fact a bad idea, so I decided it probably wasn't that. I wondered if there could be a secret ingredient in the Grundy cider. Does the tumble tussock have remarkable rejuvenating qualities? But not everybody drinks that in Ambridge. Is there a deep secret to the bacteria in Borsetshire Blue? Should we be looking at this as a new wonder drug, cure for cancer, cure for all disease? Again, I didn't think so. I can't see Joe sitting down with Borsetshire Blue. He'd probably think it one of them fancy cheeses. We've talked before about tea and cake and whether they're adding to life-sustaining qualities, and I think perhaps in some way they might be, and we'll talk about that a little bit later, but I decided that flapjacks definitely have a negative influence on quality of life and should probably be avoided. Now, if we're considering preservatives, we should probably be looking at the water in Ambridge. Artist's impression of low mead. Theoretically, whatever Brian is pumping into the water may be having some influence on the humans, but judging by the fish, I'm not so sure. Don't know. Slightly wilder conclusion. Has black magic been involved? Is Bartleby a Horcrux for Joe Grundy? And is the fate of Linda Snell intimately entwined? If the pantomime horse of Ambridge falls, does Linda Snell also fall? I thought probably not. It's a nice idea, and I'd like to see a paper on that next year, please. And then I came to this, the ubiquitous Pint of Shires, please, Kenton. And this is kind of what brought me to my conclusion. Because in the evening in Ambridge, you're not sat at home eating a ready meal on the sofa. You are down the pub. You're with your friends. And it's the same for the women. They might not be drinking the Shires, but they're with their friends, they're socialising. And basically, nobody in Ambridge is lonely. If you look at loneliness as a whole in the UK, it's becoming a really big problem. About 50% of people over 75 live on their own. 61% of widows and widowers in the UK are over 75. And 1 in 10 people over 65 say that they always feel lonely. That's not just sometimes, that's always. And studies have shown that living in isolation can be massively dangerous to your health and have similar health risks to smoking lots of cigarettes a day. And I think this is why the people in Ambridge are doing so well. They have massively high levels of family support. You have very few people with nobody. And even then, the people with nobody tend to be enjoying intergenerational living, possibly with members outside their family. If you think of Jim and Jazza and that little boys' house they've got there, I think, it's doing wonders for Jim, and it's probably also doing wonders for Jazza in some ways. If you look at the Fairbrothers and Bert, they may moan about each other, but it's giving everybody a reason to get up in the morning. There's a lot of community events. There's always something to look forward to. There's always the next thing in the calendar. And anyone who's sort of been observing Ambridge for more than a couple of years gets used to the cycle of flower and produce, blah, 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 blah. Oh, it's now time for this now, Lent appeal. And there's also a really high level of male companionship in Ambridge. And I think this is something that you don't often see. I think older men particularly can be very lonely. Women, if they lose their husbands, tend to have a social network that they can fall back on even if the children live away. But quite commonly, men who have been working all their lives haven't had that gap. They've not been taking the children to school. They've not got friends whose children grew up with them. So they tend to get a little bit lost, as it were. A male companionship in Ambridge takes some interesting and odd forms. It can be going down the pub. It can be fighting over pumpkins. But it's there. And Joe Grundy dispensing her pearls of wisdom around the village is part of that system and part of that give and take. What we're seeing actually in modern society where we don't have these communities is that we're trying to build them. So there's things springing up. This is, I think, America, where university students are getting free board if they live with older people. There's similar things in the Netherlands, students who are living with older people, sharing their lives. So there's someone around, there's someone to talk to, but again, it gives the older person something to do. They often cook for each other, they share stories, they share their friends. I'm sure a lot of you will have watched The Old People's Home for 4-year-olds. So this is a project where primary school children were introduced into a nursery environment with some older people, and it had a massive effect on both generations, actually. I will admit this is not for everyone. I had a patient recently who said that they keep bringing these children in and me and Betty hide in my room until they've gone away. That will be me. But an awful lot of people seem to get a lot out of it. And then there's things about just sort of befriending, trying to keep that sense of having someone to talk to. Men's Sheds is an organisation that's specifically building this male companionship idea. It's an area where men can just go and talk about things. It came out of Australia, I think, as a health initiative in the first place, but now it's more about just having someone. Age Connects is a fantastic charity in Wales that looks after carers as well as the people that they care for. So it gives carers a place to come and congregate. It helps them with befriending services so that they can get some time away from their caring role. There's an awful lot of older women and men out there caring for a partner who is very unwell, and they don't get the support we would like to give them. And then Friend-A-Me is a Welsh charity that's doing amazing work in my local area. They've started things like a bilingual Scrabble club. Again, it's just about building those events that people can go to, things in the calendar that they can look forward to, and it just stops that feeling of isolation. Now I'm going to talk briefly about Auntie Chris, because when I pitched this paper, she was the front-running candidate for a fall, and then she had one. And Chris, I think, was lonely. Yes, she was cohabiting, but her son lives away, she's got these financial worries, and it always seems to me like she's a little bit on the sidelines. She's never in the centre of things, it's just on the edge. And now that she's been tidied away into the laurels, I kind of worry what's going to happen to her next. I fear for her future, even without the malign evidence of Hilda. If it wasn't Chris, I think it would have been Carol, because Carol also, her children live away, we don't hear a lot about her, she seems quite isolated. I think someone mentioned that she walks with a stick. So she's pickled and stoned, probably. But then again, marijuana, there is some evidence for it. Anyway, that's a whole other talk. So yeah. I will say one other thing about Auntie Chris, and that's that her fracture was entirely wrong. From a medical point of view, she broke her hip and her pubic ramus. That's a case report. That doesn't happen. If anyone wants to come and talk to me about that afterwards, I can get really geeky about it. Anyway, so I'm going to wrap up. So I think the secret of a long life, as demonstrated by Ambridge, is to stay well, to get involved, and to keep connected. And probably a little bit of all of this in moderation is not going to hurt you. Thank you.
Thank you, Doctor.
No questions about, Carol Gray's runny nose in 1952, please.
Yeah, first there and then there.
I've long held the belief that Peggy's actually a vampire.
Yeah.
Oh, yes, okay.
That's why she's lived so long.
So,
Very good.
she could be. I don't think she lives off blood. I think she lives off of misery and drama. Yeah.
She's got cake now.
Thank you.
I just wondered if you'd like to expand on Joe Grundy's lung.
Ah.
Because it always mystified me.
Yeah, so farmer's lung is one of these chronic conditions that's caused by inhaling stuff over time. So basically, if you breathe in lots of stuff, your lungs get scarred and it can cause breathing problems. I think for Joe it's a convenient excuse not to do things when he wants. It doesn't seem to slow him down. He's certainly not breathless. It could be progressive, but I think Joe's just made it up, really. Sorry. I love Joe. When Joe goes, I'm gonna be so sad.
I have been wondering of the proximity to a doctor in other communities that we can have a view into. Quite often when a doctor lives on your street, you tend to get a lot more sick.
Oh, interesting.
And I wonder if the lack of a doctor in Ambridge is making everyone a little healthier.
So we were having this discussion over lunch, actually. I think whoever serves the Ambridge area is probably having quite a nice time of it. Does having a doctor near you make you sick? That's a really interesting question. So from data I've looked at, we know that people that live nearer to an emergency department are more likely to come in. And people that live further away, so I'm from Wales, and people that live in Powys, which is Brecon and North, only tend to come to A&E if bits of them are literally falling off. So I've worked A&E shifts where we've had farmers come in, and if a farmer comes into A&E in lambing season, you just take them straight to resus because something has gone drastically wrong. So I think access to healthcare kind of goes both ways. You need a quality of access, but also you don't need to make it too easy. How's that? There we go.
Can I ask how many medical doctors we have in the room?
Is
How
it-
many medical doctors? 1, 2, 3,
Oh, hello.
1, 2, 3, 4, 5. Well, watch it. 5 here.
So you can all tell me that was nonsense afterwards, lovely.
They never would. Well, thank you.
Another question?
Oh, there's one
Over
there. Yeah.
Hello.
Granted all the instances there are of people overturning tractors, falling off roofs, getting hit and run, car accidents, dying of mystery ailments, perhaps they never live long enough to get diabetes.
Well, so this is the other thing. What doesn't kill you at 60, lets you live a little bit longer. I think there's going to be a lot of talk about death tomorrow, but to me it seems you either die horribly and die young, or you just sort of close your eyes in a room and someone walks in. There's nothing in between, and we were talking about actually the lack of an end-of-life story. Jack's dementia, obviously, was a very kind of realistically lengthy, drawn-out process. I wasn't observing Ambridge at that point. But I think there is a lack of kind of someone chronically unwell in the older generation. Now, whether that's what they've got in store for Auntie Chris, I don't know. Now she's removed from Hilda Ogden, she may do better. Okay.
Thank you.
Thank you.
Really love that. Nice. Just one more.